welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/podcast. Today's show, we have Alex Seabury. She is a pediatrics resident. Her Kevin MD article is titled, Let It Go. A pediatrician reflects after a difficult conversation. Alex, welcome to the show.
Thank you so much for having me. I really appreciate it.
We'll get into the article in a little bit. First off, briefly share your story and journey to where you are today.
Originally, when I came out of college, I thought I wanted to be a child psychologist. So I went and got my master's in school psychology, child psychology. And in starting to practice that a little bit, I realized I wanted to be more on the medicine side. So I went to Cooper Medical School here in Camden, New Jersey, did their 3-year pediatrics program, and then matriculated right into our Cooper Pediatrics residency here.
Excellent. And what are the rewards of pediatrics today? What drew you to the field?
The correct answer here is everything about pediatrics. I love that I get to invest in our future every single day. I love I get to see bits of myself from when I was a teenager, when I was younger, and just getting to relive the world through their eyes. I think it keeps us young, it keeps us fresh, and I just love how resilient they are. So every single day, I just love getting to come in and see our kiddos.
And you're a second-year pediatrics resident, yes?
Yeah.
And just from those last couple of years, what are some of the challenges that you see facing pediatrics going forward?
COVID was a huge thing for all of our kids. I think it really highlighted a lot of the things that we were feeling prior to the pandemic, not having adequate mental health resources and how important school is to kids and the social aspect. And so when a lot of our kids could not attend school for extended periods of time or no longer had access to early intervention or limited access or their therapist or their psychiatrist, we really saw a lot of regression in a lot of kids. And so I think now that we're starting to come out the other side, we're asking ourselves, what changes are we going to be able to make to reintegrate all of these kids? So we're seeing now a lot of kids that hadn't been seen in 2.5 years, whether it be a well visit or a very serious psychiatric concern. And so really trying to bring them back into the fold and ask ourselves how we can do better.
All right. Now let's turn into our Kevin MD articles titled, Let It Go, a pediatrician reflects after a difficult conversation. Now, for those who didn't get a chance to read your story, just walk my audience through it. Share the story why you decided to write it.
Sure, absolutely. It was about halfway through intern year. And in medicine, the difficult encounter is really just part of the deal. But I think this one was one that impacted me the most because of the pain that it caused me afterwards. And it was a kind of a general failure to thrive admission that we saw in the clinic. And it was just one of those times where I felt like I had to sit down and write about it and say, what did I do here? What happened here, really? And how could I improve in the future? But I really wanted to write this because I think it's important for clinicians to put it out there that we're people too. And a lot of times I think we get a rap that we just get to leave this stuff at work. And we really, truly do not. We take this home. We see it in our own families. And also to write for people who aren't providers to understand that as well, that the difficult encounter goes both ways, that it's very stressful for them, very stressful for us. And so we really need to be able to come together to figure out how we can all do it better, because in pediatrics, really the focus is the child, and often the patient can't speak for themselves. And so it's really amongst adults to have these difficult conversations. And how can we align everything so that we're really doing what's best for the patient?
So take us into that difficult day for those who didn't get a chance to read your story.
We had to advise the caregiver. The child was at a point developmentally and weight-wise that they were going to have to be admitted to the hospital. And with pediatrics, a little bit different than adult medicine because certain admissions that they're no longer up to the parental judgment at that point, that the provider can make the call that the child has to be admitted for their own safety.
So how did this child present to you that day?
So that day, the child had not been seen since they were a newborn. I believe they were now approaching 4 or 6 months old, had completely fallen off the growth chart. So they were failure to thrive levels, not developmentally appropriate, and all the physical signs there. And I even wrote it in my piece that it was one of those encounters where we always learn sick, not sick in medical school. And this was a sick child, very ill. And it was one of those where the parental concerns did not align with our concerns. And the parent really, this was a first child and did not feel that there was a problem. And in going through the history and things, there were a lot of medical concerns for this child. And so we had decided that we had to inform the parent that this was going to be a mandatory admission. And the parent took that very personally. And the response was very angry, very accusatory.
Now, were both parents in the room or just one?
Originally, it was just one, but because we were talking about admission, the other parent did come. And they also had an additional family member on the phone. So it was a very volatile environment. And they were very angry at me. And I was able to pull my attending in, and they were very angry at that person as well. But the words just got so personal. I think that was what hurt the most, is that I really felt like I was trying to come from a place of helping this child, that it was not meant to be punitive or anything like that. But when the parents did not share similar concerns, it was a very difficult conversation. And I think the hardest part for me, I have a 15-month-old son now. He was a fairly similar age at the time. And one of the caregivers asked me if I was a mother. And I said that I was, and they said that I couldn't possibly be a mother if this was how I felt about this child. And that stung quite a bit. So it was that kind of back and forth, trying to keep it as civil as possible, but just not seeing eye to eye. And that was a difficult day, I think, for everybody.
What were some of the things that those parents said to you, or some reasons that they gave you that they didn't want their child to be admitted?
Sure. So in their minds, the child was eating appropriately, seemed appropriate, sleeping appropriately, that they really felt that the stature of the parents was being reflected in the child. And even though we were pulling up the growth chart and showing it to a non-medical person, that really doesn't mean an awful lot. Yeah, he's a little on the thinner side, but so was I when I was a baby, kind of stuff like that. So I think that they felt that their child was normal, and they felt that we were trying to take the child away, was really their angle.
And then you brought the attending into the room, and what happened next?
So the attending mirrored a lot of what I had said and reiterated a lot of it, but it just really wasn't going anywhere. It was a stalemate, because we were trying at first to get the caregivers to bring the child over voluntarily. That would obviously be in the best interest of everyone. But once there was pure refusal, that they did not feel that the child needed to be admitted and would not present the child, then we had to go on to the next steps, which is getting kind of child protective services and things involved to make sure that the child got the care that they needed.
All right. Tell us what happened next in the story. So the child was admitted, and then what happened after that?
The child had a very extended hospital stay, that it was found that it was most likely nutritional deficit. That was the reason that the child was not growing, and that once the child was adequately supplemented, that they grew fantastically. And last I checked in, my attending does still follow with the child. The child was doing excellent, has come back on the growth curve, and is doing very well. So the admission did end up being the right thing for this child, but it's still, I think that was what really struck me, is that even knowing that, how much this encounter really stuck with me for the next several days. And now it's interesting, it's been months, and going back and reading the piece today before chatting with you, how differently I'm able to feel reading it now than I did then. And I think residency is just a time of such constant growth, that it was fascinating to me to revisit those moments and how I felt very acutely, and now how I feel months and months later.
Yeah. So talk more about those feelings. Can you contrast how you feel now versus back then?
Sure. So at the time, this was so fresh. And as clinic progresses, once that child left to go for the admission, I just had to walk into another room when in the fast-paced environment. And I believe it was in the morning, kind of lunchtime. So I still had a full day of patients, and trying not to let that cloud anything, because these next patients, they don't know what happened.
Yeah.
They just are expecting great care, and that their child is now 100% of my focus. And so it was really an exercise in emotional regulation to get through that day. And then leaving, I cried in the car on the way home. I just felt so awful in a way that I didn't really understand, because I felt I had done the right thing, but it still felt so wrong, and it still hurt so much. And so I was battling with, what parts of this do I want to keep with me? And what parts of this do I need to put behind me in order to move on? And so that's really when I sat down to write the piece, was to say it has this residue effect of it. And parts of this I want to keep and parts of this I want to throw away. And right now it doesn't feel like I have a choice in terms of what's staying and what's leaving. And now I can look back, and there's been many difficult conversations since then. But I think I've now been able to say, okay, look at it more from a clinical perspective than an emotional perspective, and say, when we have a failure to thrive admission, which is not particularly uncommon, how do I want to approach that differently? How can we come at this in a way that's better for the patient? How can I phrase it in a way that's understood better by the parents? How can we all be one team instead of more of an adversarial relationship? And I think it's helped. In the end, it really has, this encounter, as unpleasant as it was, I think it's really informed my care since then, because I've been able to take a lot of the emotionality out of it and really look at it for the educational experience that it turned out to be.
Now, if you had to relive this encounter all over again, what would you do differently? Or what would you say differently?
I think I would try to come at it, like I said, more from a team perspective. And it was really hard in that case because the parents didn't have any concerns. But I think changing the way I was trying to educate the parents about my concerns, because I think that we jumped right to admission and our concerns were so great that I think I skipped some steps educationally and really breaking it down and saying, this is why I'm concerned. And let me show you what I would expect here, or this or that, or what he should be doing. And I'm not sure if it would have changed the outcome, but I think that was something that I really took with me into further encounters, to say, we need to start with the education, because I can't expect them to just understand why I'm concerned. So I think that that was my big thing I would change.
Now, have you or your attending had any future encounters with the parents, and do they realize that you guys did the right thing?
So interestingly, the parents are actually no longer have custody of the child. And so the child is now living with a family member and has done fantastically and follows for their well visits with the attending that came in the room with me that day. So we never really got the chance to repair that relationship. And I think that would have been helpful, because it just got left the way it was left. And we never really got to circle back even for their feedback of how we could have done better. In that way, we haven't had a great conclusion, but the child is doing so well.
We're talking to Alex Seabury. She's a pediatrics resident. Her Kevin MD article is titled, Let It Go, A Pediatrician Reflects After a Difficult Conversation. Alex, what kind of wisdom or advice can you share with, say, new interns, medical students? They haven't had a lot of opportunities to have these difficult conversations. What kind of advice can you give them?
Sure. I think that what I always try to do, especially in pediatrics, is approach every interaction with love first, because sometimes I think we need to leave the clinical stuff at the door and always enter in to try to love every family, love every patient. And I think that if you come at it from that perspective, the knowledge, the everything else will follow. But I think you will always provide excellent care if you just approach it just like you would want anyone to give care to your child or your family member. And I think patients and families can feel that when you're there to understand them and you're really there to help them, not necessarily to, to doctor to them. I think that they tend to appreciate that, and that can help you to not even get to the point of a difficult encounter in the first place, because I feel like so many difficult encounters are built out of people feeling frustrated, not feeling listened to, not feeling respected. So when you enter in any encounter in that way, I feel like you can help to avoid those difficult encounters altogether.
And my final question, what are some of your take-home messages that you want to leave with the Kevin MD audience?
I would say, at the risk of repeating myself, but lead with love for your patients, lean into what you're doing, get involved in what you're doing. That's a tip for success for me in residency, is just to say yes as much as you can to every opportunity, because it flies by. And to remember that patients are human, doctors are human, everyone's human, and everybody wants to feel good after encounter. So just keeping that in mind when you go to the doctor, or when you're being the doctor or the clinician, that everybody here is human and deserves some grace.
Alex, thank you so much for sharing your story, time, and insight. Thanks again for being on the show.
Absolutely. Thanks for having me. you.